Hello and welcome to EULAR 2025 Room Now's coverage from Barcelona. My name is Mrinalini Dey and I am a rheumatology fellow and PhD student at King's College London in the UK. And I'm reporting for Room Now from EULAR 2025 this year. I want to bring to you an abstract which I will be presenting actually on the first day of the conference on Wednesday, the 11th of June, which is OP0026. And this is about the association between health literacy and clinical and non-clinical outcomes. So, for example, disease activity, but also mental health and also work outcomes. So, why is health literacy important? So health literacy, first of all, the definition, according to the World Health Organization, is the ability to understand, access and use information in order to make good healthcare decisions, not just for oneself, but also for people's communities and their families. And actually, the World Health Organization has deemed this central to the control and prevention of non-communicable diseases, which of course includes the rheumatic diseases. Health literacy has been said to be a potential social determinant of health as well. So it's really important that we know exactly what its role is for our patients with inflammatory arthritis. So in order to look at this association between health literacy and various different outcomes, we use the resources of the National Early Inflammatory Arthritis data set in the UK. So a bit of background, this is a cohort, it's an audit actually, that's been running since 2018 in England. And it basically includes people with suspected inflammatory arthritis. So we identified people with specifically persistent disease within that cohort, and we did a cross-sectional study. So in order to do this, we developed a survey which included various validated questionnaires. So you'll be familiar with the WPAI, which is used to look at employment and work outcomes, the GAD2 and the PHQ2, which look at anxiety and depression. But we also used the 44-question 9-domain health literacy questionnaire. And this is a great questionnaire because it is able to look at the multidimensional construct of health literacy and not just in a 1D dimension as might have previously been done, for example, when looking at functional health literacy. We also asked people to give various information on socio-demographics and also their current and previous treatments, as well as their self-reported disease activity and tender and swollen joint counts. So we sent the survey out to 3,300 people and received 995 responses, which is actually pretty good for a survey-based study. And the responses were then matched actually back to people's original records within the national cohort. The median age of participants was 59 and around 2/3 were female, which is fairly typical for an inflammatory arthritis cohort. Looking at the analyses, so we conducted multivariable logistic regression analyses and linear regression analyses depending on the outcomes being tested. And we controlled them for age and gender, and then further again for educational level as well. In essence, we found that low health literacy associates with greater self-reported disease activity, greater levels of mental health as measured by the GAD2 and the PHQ2, and also greater levels of absenteeism and presenteeism. And so that's looking at, firstly, how often someone turns up to work, but also how present they are once they're at work and their level of impairment. Specifically, out of the 9 domains of the health literacy questionnaire, we found that having access to health information and understanding health information well enough to know what to do with it were particularly strong predictors of these poorer outcomes. So in conclusion, we found that low health literacy associates with greater disease activity, lower mental health, and poorer work outcomes as well. And it's likely that that association is bidirectional. And furthermore, the association between disease activity and employment outcomes has been well established through multiple inflammatory arthritis cohorts. Many of the work has been presented at EULAR previously. And it's likely that that association also involves a level of health literacy as well. So, for example, you don't go to work, you have a greater level of social disengagement, and perhaps then you find it more difficult to speak to people about your health and find that important health information that can then be used for you to be able to make those important healthcare related decisions. This work is important because hopefully it can inform health policy widely, but also specifically, it helps us to create targetable interventions, looking at exactly which domains have been affected and lead to these poorer outcomes. And then hopefully that can help us to manage our patients with rheumatic diseases better. This is just one abstract on health literacy that is being presented at EULAR this year. If you'd like to know more about the HLQ that I mentioned, so the Health Literacy Questionnaire, I am also presenting a poster right before my talk tomorrow at 3:30 in the poster hall, where I'll be talking more about the Health Literacy Questionnaire on its own and the psychometric properties of it. If you'd like to know more about the background to this work, so the systematic review that I did, I'll be presenting that on the poster tour for PARE on Thursday morning. And there is also the health literacy health professionals in rheumatology session as well at EULAR. So there's plenty to get your teeth into if you'd like to know more about health literacy. If you'd like to know more about everything else going on at EULAR 2025, don't forget to check out the Rheum Now website and follow us on the socials. You can follow me at Dr. Mini Day on Twitter and Blue Sky. And I will see you again soon for another video.